Namaskar dosto. Good evening. I am Purnima from Fertility Dost, and once again I welcome you all to this wonderful platform of ours, Fertility Dost. जी हाँ, आप यहाँ पे सवाल पूछ सकते हैं, अपने डाउट क्लियर कर सकते हैं और चाहें तो हमसे कनेक्ट भी कर सकते हैं. You can definitely call us directly on our official number, which will be shared in the comment box, and do visit our websites for wonderful informative articles. And today's session is interesting and today's session is really important. We are doing this session with ART Fertility Clinics. They are knowledge partner for this session. And for this session, we have our very own Dr. Patel. So आप सोचिए किसको बुलाया है हमने, तब तक हम डिस्कस करते हैं about the topic. So topic is related to fertility preservation. Usually fertility preservation is very common topic, but आज हमने सोचा कि fertility preservation in what cases. हर बार हम बात करते हैं, if you are young, you are not planning your family, you can go visit a fertility clinic and just ask doctor if is it possible for you to preserve your eggs, or if you are with your partner and you are still thinking to wait much more few years to plan a family, then also you can visit a fertility specialist and ask them to preserve your embryos. But अगर ये दोनों cases आपके सामने नहीं है, तब अगर कुछ ऐसी कंडीशंस हैं, कुछ मेडिकल इश्यूज कंसर्न्स हैं जो कि आपको फोर्स कर रहे हैं टू विजिट द फर्टिलिटी क्लिनिक एंड जस्ट आस्क द डॉक्टर, क्या मैं अपने फर्टिलिटी को प्रिजर्व कर सकती हूँ. सो on such occasions usually we talk about ovaries, because ovaries में cyst होना, ovaries के साथ issues होना, या ऐसा कोई treatment लेना, heavy doses medications जिससे हमारी ovaries एग प्रोड्यूस करना या फॉलिकल प्रोड्यूस करना बंद कर दे, एंड आफ्टर दैट हमारे पास वही एक ऑप्शन रह जाए फॉर डोनर साइकिल. And at times we feel it's difficult to think about donor cycle. So we decided a topic, role of fertility preservation in ovarian cyst. Yes, thoda sa twisted topic hai, but think about it. It is really important to know your fertility when you are going for preservation, and particularly when there are some medical issues with you. So we decided to discuss this topic with Dr. Erika Patel from Chennai. She is a head of ART Fertility Clinics. Let's call her on the main screen and start with the sessions. And meanwhile, please, आप अपने क्वेश्चंस पूछते रहिए. नमस्कार डॉक्टर एरिका, वेलकम टू फर्टिलिटी.
Thank you so much. Very happy to be here back again.
Thank you, thank you. So, viewers, we have Dr. Erika Patel with us. She is head of ART Fertility Clinics, Chennai, and she is a consultant gynec fertility specialist with many years of experience. And interestingly, she has treated male and female infertility cases in equal number. तो यहाँ पे कोई bias नहीं है कि female doctor है तो female fertility treatment ही दिया है. So you can ask questions related to male infertility also. She believes in ethical treatment. Ethical term here is important because आजकल हमने बहुत बार देखा कि कुछ चीजें as a patient मुझसे छुपा ली जाती हैं. Some clinics, some doctors are not transparent with the reports, sharing of reports and telling you the exact thing. Sorry. So अगर आप ethical process या if you are thinking of going for ethical line of treatment, then please do visit ART Fertility Clinics for that. And with Dr. Patel, we will discuss about this fertility preservation, or we can say that fertility preservation in ovarian tumors. So first of all, Dr. Patel, there are many type of ovarian tumors. ट्यूमर सुनते ही डर लगता है कि कैंसर हो गया, बट एग्जैक्टली ऐसा नहीं है. सो फर्स्ट ऑफ ऑल आई रियली वांट यू टू एक्सप्लेन लाइक एक्चुअल में ट्यूमर्स है क्या, और यहाँ हमें सच में इससे डरने की जरूरत है अपार्ट फ्रॉम दैट कैंसरस ट्यूमर.
So, when we talk about tumors, medical terminology, we divide it as malignant or benign. Benign are the ones that are not cancer. They are some sort of a mass which is not supposed to be there in the ovarian tissue. And malignant are the ones that we have to be a little scared about, or are what we call as cancer tumors. So when we talk about ovaries, there are a lot of benign tumors that are there, or even cysts या कोई भी mass जो ovary में होता है, very commonly what we call it as a dermoid cyst, which has multiple things inside the cyst. There can be regular cyst, which is filled with only fluid, or there can be something like endometriosis, which has blood clots inside. So all of these are also harmful for fertility. But more importantly, when we talk about cancer, now we have two things to deal with. We need to treat that cancer, and we need to save fertility also.
Right.
Unfortunately, most of the cancer drugs or radiotherapy that we give is very, very harmful to the eggs. So it is very important that we spread this awareness that anybody, because at that point of time, when a doctor tells you you have cancer, the last thing on your mind is when will I have a child? Right? Because you want to, all you want to do is treat that cancer. But later on, we find, later on, when the cancer is treated, everything is cured, and then we figure out that the eggs are also gone and now I can't get pregnant. It's even more depressing. So I think there needs to be an awareness, not only in patients, but I think by now the oncologist and the fertility specialist needs to work together for any cancers in patients who have not completed their families or who are in the reproductive life, or in fact even girls who are minors, pre-pubertal or pubertal girls having,
Right.
because at that point of time we're not thinking of 20 years down fertility, but then we should be thinking about it.
Right. So, doctor, we all know that, okay, if it is really possible to freeze your eggs or to freeze your embryos, but nowadays there are many new technologies or new terms that we are hearing in this fertility circle, that yes, you can preserve your ovaries also, ovary tissue, preserved ovary tissue can do a wonder. So, what exactly is this? Like, do we really have this option?
Yes, so if I go from the easiest to the hardest, the easiest to do is embryo freezing. It's a tried and tested, it has the best results. But embryo freezing, when can you do? When you have a partner or you have
Right.
already been introduced. Because it is an egg and a sperm, you make the embryo, you freeze it, then the patient takes the cancer treatment. But if this is about, even if it is about a girl who has achieved puberty, who has started her menstrual cycle, who has started ovulating, started making eggs, but not does not have a partner, for these girls, we recommend oocyte freezing, where we freeze only the egg.
Right.
And many years back, this was an experimental treatment, but now day in, day out, we here itself do so many cases of oocyte freezing, and it is very, very safe and very, now it's tried and tested. So for them, we can just freeze the eggs. The tricky part comes in prepubertal girls who have, say, somebody is just 10 years old, or a pediatric cancer patient, or anybody who has not even started forming eggs. So in these girls, we recommend something called as ovarian tissue cryopreservation, where we take strips of the ovary and we freeze it. These are all defined step by step techniques that we follow. And once her cancer treatment is over, we go via laparoscopy or open, however, and we put the ovarian tissue back. And this ovarian tissue is thankfully so good that it does start forming hormones again. It does start forming hormones again when it hits puberty. They start making eggs. There are pregnancies reported from this. So it's that is one of the options. The other option is also taking out entire ovary and transplanting it back. And
Okay.
then the last thing, which we don't do so much but can be done, is where we put the ovary a little, we attach it a little away from the site of radiotherapy. As in, say here, this is the part, if you have to give radiotherapy, we take the ovary, we put it, fix it somewhere else in the abdomen, finish the therapy, and we bring it back. So all these requires a lot of blood vessel connections and everything, but it is all doable and all done also.
Okay.
With all
But
of these things, pregnancies have been reported, but the maximum chance of pregnancy is with oocyte and embryo cryopreservation.
right. And how safe is this process? Because you were just mentioning the girls who are in their early years of teens, or so we can say
Yeah.
that 11, 12 years, if they are dealing with some very life threatening disease, and we really need to preserve that ovarian tissue. So how safe is that for that girl, so young girl?
These are all very, they can be done with a minimal invasive manner. They generally, the surgery by itself is very safe. The only complication comes that also while we putting it back inside after the treatment is over. The only
Hmm.
disadvantage is that sometime the blood vessels may not give enough blood, and sometime that tissue may not survive when we put it back. But if it is
Okay.
done correctly, it is very, very safe to do. And definitely, tissue cryopreservation is very safe.
Okay. And what exactly is you have to stay in the hospital, or it's a day process or
It's a
daycare
daycare
thing?
procedure. It's a daycare procedure, but we do monitor them for bleeding and pain and everything. But it's a daycare procedure. It takes about half an hour, maximum 45 minutes.
Okay.
The
And
taking out of tissue is a very easy part. Then it's the lab part because there is a very lengthy process to freeze the tissue because of the survivability that we need when we take
right,
it out.
right, 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 right.
Yes.
I think I have heard a few days back that the tissue was extracted from mother's womb and transferred to the female. Is it really possible to transfer tissue of one female to another?
This is all very experimental, but there is something called as HLA matching, like how we do organ transplants. Because we
Mm-hmm.
now do uterine transplants also, right? So if there is a proper matching done between the two, and HLA matching and blood group matching, quite possible. But then all these inter person transplants need a lot of suppressive therapy later on, so that your body doesn't react to some foreign tissue.
Right, right. So I think such procedures, or for using these technologies, you really need to head towards the more advanced clinic rather than visiting simple gynec or
Yes,
taking those advices. Right.
absolutely.
Doctor, in the topic we mentioned about ovarian tumors, and we all know that tumor is associated with cancer, and these things do happen, and we have to take high doses of medicines and all. So, for after how many years of suppression of cancer, we can again go ahead with pregnancy if we have preserved our eggs or embryos. So, in case of embryos preservation, how many year gap is necessary for me to go visit my fertility specialist and take the transfer back in my uterus?
So it's a very patient to patient decision, but that decision we leave it to the oncologist
Oh,
because they have the 1 year and the 3 year follow up after chemotherapy treatment. And once they clear in the, probably I would personally like a 3 year gap, but everything depends on age. Say this is a 22-year-old I'm talking about, then I'll wait for 3 years. If you remember, I'm talking about a 39-year-old or a
right,
40-year-old.
right.
So it depends on the age of the patient also, and more importantly, on the clearance of cancer. Once the oncologist completely clears the patient of chemotherapy, I mean, sorry, cancer, then is when we would proceed. And also, there are certain tumors, because we're talking about ovarian tumors, and there are certain breast tumors which are very estrogen dependent. So, the entire treatment of IVF, as well as the whole pregnancy, right? Your estrogen levels are very high. So, in these cases, we need to be even more careful that it's absolutely clear, because if there is a tissue, cancer tissue, or cancers, even few cells that are there,
Right,
and
right.
are giving estrogen that's like feeding the cancer, then it may just bring the cancer back up. So those are tumors where we have to be very careful, and a longer gap is something that I would recommend.
Right, right. I think. when we are talking about preservation of ovarian tissue or preservation of eggs or embryos, at that very moment the coordination between the doctor two doctors are more important, because
Yeah.
fertility specialist doctor should be more aware to suggest the patient that yes, you please connect with the fertility specialist, that kind of thing, right?
Yes. In fact, that's what I was trying to tell you, right? That it's very difficult for the patient or the patient's family at that
Right,
point of time to think about this. They don't.
right. Like उस टाइम पे तो ये लगता है जान बच जाए बस,
Yeah.
फर्टिलिटी को हम बाद में देखेंगे, राइट, टू एग्री विद दैट. And doctor, I don't know, I think this is a misconception only. लोगों का मानना है जितने ज्यादा स्टिमुलेशन लेते हैं ओवरीज में कैंसर होने के चांसेस उतने बढ़ जाते हैं, एंड वी ऑफन हैव दीज क्वेश्चंस, बिकॉज 3 साइकिल हो गए, मैं आगे नहीं बढ़ना चाहती बिकॉज आई नो द होल लॉट process, the n number of injections, medicines, they must be doing some thing in my ovaries and I'll destined to have this cancer. So how
So see
your
where yes, we do get asked this question a lot, and this is what I answer that there is evidence for everything. And these questions from where they're coming are, if you type in Google, you will find a few people who are saying yes, yes, yes. But it is like you check in 5 patients and 1 patient, you have to see how well that study was done, how ethical that study. All these, there will be studies like this, but when it's done in a very few number of patients or only in a select few patients where there are a lot of biases in the study, those are the studies that we don't accept. And according to literature, as of now, there's not been a single study that has proved higher risk
this
of cancer
cancer
in
stimulation?
stimulated patients. Yes, it does not. And lot of patients feel these hormones are bad for the
Right.
body. What
Mm-hmm.
I would say is, the moment you take 10 days of injections, for example, you're really pumping up the body with hormones. Then we do the egg pickup. The moment you get your first period, all that has come down to the fact that you've got your first period, all that hormone levels have come down to baseline. If you have really, really, really high hormones, you usually do not get your period. So, b- menstrual period basically comes because of withdrawal. वो बोलते हैं ना कि मैंने withdrawal tablet लिए फिर period आया, मैंने
फिर हाँ.
tablet फिर withdrawal. That is what that withdrawal means, is all the hormones go down to zero, and because there are no hormones, you start bleeding. So even after IVF, the moment you start bleeding in your next period, that means your hormones levels, everything has come down to baseline. So technically in your body, that was only there for 10-15 days. That is how I tell my patients that it's not going to do that much of harm in long term, because it's not staying in your body for long term.
Right. So flushing out of process is there
Yes.
through periods. So, doctor, one more myth is there that if we are undergoing n number of stimulations, then there are higher chances of increase in FSH levels. Is it really so?
What I didn't get your question. FSH levels where? Sorry.
FSH levels usually increases or rises if we are taking 2 or 3 stimulation cycles.
No, so FSH level basically same thing. You have a baseline FSH level on your second or third day. As
Hmm.
and when more follicles grow when you're giving the injections, first of all the IVF injections are FSH and some of them have LH. So while you're taking the injections, your FSH levels will rise. Once we do the egg pickup and once the trigger happens and we do the egg pickup and everything goes down, the FSH level comes to baseline. Again, same thing, only when that comes to baseline, you get your period. So you take a next stimulation, it will go up. But over time, FSH going up is not stimulation, it is the age. If I'm 35, my FSH is 7. If I'm 39, my FSH will go to 8 or 9. A higher FSH equals to lower egg count,
Right.
equals to increased age. So it has nothing, no relation with the number of stimulations that are taken.
Right. And this number of stimulation also, it's like if we are going for this thing, embryo pooling, so we are taking two or three stimulations at one go, like एक एक period cycle पे we are taking, so this increases the chance of ovarian cancer.
No, no, it does not. There's no evidence to prove that. And honestly, even in embryo pooling, most of the doctors or most of the consultants would do it only, say, 2 months or 3 months. I
Hmm.
don't think I have heard anybody doing 4 months continuously or 5 months continuously. So no, it does not. There is no scientific evidence that it increases the chance of ovarian stimulation. In fact, it's good because what happens is when you stimulate an ovary for the first time ever. Now we're talking about a patient who's not gotten pregnant. So that means those ovaries are, you can call, there are a lot of follicles that are sleeping. Then you give injections for the first stimulation. You will get a certain number of eggs. And then when you do a second stimulation, the first stimulation itself has woken up a lot of dormant sleeping follicles and stimulated it. Many a times you will see the second one is so much better or yields a better outcome than the first one, because the first one actually stimulated a lot of sleeping eggs to get up and come up on the surface.
Okay, right. सो ऐसा मत सोचिए बहुत स्टिमुलेशन साइकिल्स हो गए तो अब तो बस सिस्ट होना जरूरी है. इट्स नॉट लाइक दैट. And often we have this very common cyst, we can say, is chocolate cyst. So whenever we discuss about this, so doctor suggest laparoscopy for removal of cyst. And again, फिर वो डर कि इसको निकाल दिया तो हमारी ओवरीज भी साथ में चली जाएंगी, कुछ टिश्यूज चले जाएंगे, तो उसके बाद तो बिल्कुल फर्टिलिटी विल बिकम जीरो. सो
Yeah.
what exactly is this when doctor suggests us that
Yeah.
yes, you need to go for this chocolate cyst removal?
So you've got the correct doctor to ask me, because I'm very against, very much against laparoscopy for chocolate cyst removal. Reason being exactly what you said. The thing is, the chocolate cyst is because it's like old clotted blood. That's why we call it a chocolate cyst. It's so destructive to the ovary, because it's like dirty. Imagine, if I have to say it simply, it's like dirty blood there. It is destroying the ovary, versus a clear cyst which has only fluid. It does not do much to the ovary. What happens is this gets very firmly attached to the ovarian tissue. So when we try to remove it, there are two things that we need to do. First is we need to take the wall out. If I only remove the cyst and I leave the wall which is attached to the ovary, within the next 3 months the patient will have it again.
Again,
There's a
right.
very high chance of recurrence. So अगर मैं laparoscopy कर रही हूँ, तो my aim should be to take it out completely. Now, when I try to take it out completely, every ovarian follicle that is in the surrounding of the cyst is going to get removed along with the cyst wall. This
Oh,
is why an AMH of a patient before an laparoscopy for endometriotic cyst and after will be drastically different, because I have removed so many of the patient's eggs in order to remove the chocolate cyst.
oh,
So
okay.
I definitely don't recommend any patient who's trying to get pregnant or going for IVF, for that matter, should do the IVF first and then go remove it, because I give the chocolate cyst is just there. I do the IVF, take the eggs out, and then do operate it. That is a better way to go about it rather than operating first.
ओके. एंड यूजुअली इट हैपेंस दैट डॉक्टर ने बोला था हम यूट्रस चेक करेंगे लेप्रोस्कोपी करके एंड वील चेक सम एडहेशंस पॉलिप्स कुछ भी होगा फाइब्रॉइड्स, तो वी जस्ट क्लियर दैट आउट.
Yes.
But during that process, during that procedure, doctor just mentioned that yes, there was some cyst in the ovary and we removed it. तो उसका क्या मतलब? Then also it is like कि गड़बड़ हो गई है.
Yes. So I think I think now all, like, we have so many resources like this. I think every patient should ask the doctor this question before and tell them that, let me know, because see, चॉकलेट सिस्ट अगर इतनी बड़ी है तो यूएसजी में पहले ही दिख जाती है.
पहले,
What
राइट.
you are talking about sounds to me more like a PCOS ovary, जहाँ पे ड्रिलिंग करते हैं. Now,
बोला,
drilling
राइट.
itself, I think, if you ask me, I consider it as a crime unless and until it is absolutely required in a very resistant case जहाँ पे कोई भी medication काम नहीं कर रही है, कुछ भी नहीं कर रहा है, and we do drilling. Because the same thing happens when, how we do drilling, what ovarian drilling for PCOS is, we're taking a cautery, which is like a, which burns the ovaries, because we're trying to cut the eggs down. Now, what happens is, again, in these patients also, you never know, you can't see it. You're trying to burn one cyst, you end up destroying so many things in the surrounding. And then these patients, so many patients, I'm not even just saying it. I mean, I see so many patients who will come and tell me, my AMH is zero point 0.5. You ask them, did you do ovarian drilling? Yes, we had done ovarian drilling. So, ovarian drilling for PCOS is only limited now to patients who have extremely resistant PCOS, because there are too many other therapies now available for PCOS rather than doing this. So what you're saying, that doctor says that मैंने ये करा था और cyst किया, that's usually this drilling that happens. क्योंकि endometriosis, simple cyst, वो सब USG में पहले दिखना चाहिए सर्जरी
दिख
से
रहा है.
पहले.
राइट, राइट, राइट. So I think यहाँ पे it is really important to ask more questions
Questions.
from your doctor. बात
Yeah.
करो, पूछो. It's not that कि डॉक्टर ने बोला. We are not saying that doctor is doing something wrong or some other procedure that may not be needed by your body. So, but do ask questions. बिकॉज वी हैव मेनी केसेस जहाँ उन्होंने बोला कि डॉक्टर ने कहा हमें ओवरीज में भी कुछ दिखा, तो हमने उसको हल्का सा टच किया एंड देन अगेन दिस एएमएच वाला कंडीशन. Last question, I think it is not related to the main topic, but how important is AMH values? Because आजकल we focus on more on AFC. So what you suggest कि सबसे पहला टेस्ट जो होना चाहिए जब मैं फर्टिलिटी डॉक्टर के पास जा रही हूँ, तो it should be AMH or something else?
I'm still a little bit old school when it comes to this, where I like to see what I can see. So I still do my ultrasound and count the number of follicles. Not that I don't trust. AMH is a fantastic test. It is the best test that is available for ovarian reserve testing. The only issue is the lab variability. Today, if
Hmm.
I give my AMH to 4 labs, all 4 of them will give me a different
Oh.
value. Reason being, it's a very new test. AMH को आए मैं 10-15 साल से हम यूज 15 साल से उससे
अरे
20 साल
यार.
पहले यूज नहीं करते थे. हमें AMH पता भी नहीं था कि वे यूजिंग इट फॉर दिस. Now
Hmm.
only we've rampantly started using it, and there are very different ways of measuring AMH in the lab also. There are different techniques that each lab uses. So some of the techniques are fine, some of the techniques are not fine. So it has a very lab to lab variability. And over time, हर एक fertility doctor figures it out. Like for me, मैं देखती हूँ कि 5 eggs दिख रहे हैं मुझे, उसकी
Hmm.
AMH कितनी होनी चाहिए. अगर मुझे
Right.
लैब गलत है तो मैं उनको वापस भेजती हूँ, ये गलत है, इसको रीचेक करो. So that what does that mean? That means I'm believing my ultrasound more. So I think the
Ultra.
first thing is counting the follicles on ultrasound. Because even when we talk about low AMH, आजकल हम बहुत ज़्यादा देख रहे हैं low
बहुत
AMH
common. Even
patient.
I can say that in 23 or 23 4 age,
Yes.
less than one.
Very young patients में देखना मतलब, you see it and you're in shock, and then you're like, how did, and but it's coming too much. So earlier क्या होता था कि if you theoretically see कि भाई 0.2 AMH है, तो इनको तो कुछ भी नहीं है, कोई भी eggs नहीं है, इनको donor cycle रेफर करना चाहिए. But then when I put the probe, मेरे को 4 follicles दिखते हैं. So if 4 follicle दिख रहे हैं, तो then this patient, you can give a chance with the self even though the
Mhm.
AMH is 0.2. So in these cases, I definitely base my treatment plan on what I see. If I see 4 5 follicles, I tell the patient, you please try it with your own eggs.
Right. And I think this is the most important thing because कहीं ना कहीं डोनर साइकिल को लेके हम एक बार जरूर सोचते हैं एंड अगेन अगर
Yeah,
जरूरी है ऑप्शन नहीं है देन ऑब्वियसली डोनर साइकिल इज द बेस्ट थिंग बिकॉज एटलीस्ट आप यू कैन एंजॉय दैट मदरहुड जर्नी एंड
yes,
you could be a mom. So that way
absolutely.
donor cycle is really important. But this is nice. तो next time जब आप report में AMH check करें तो एक बार do visit your doctor and ask for that scan. So doctor, AMH we can check on any day of our periods, like
That's the
any.
biggest advantage of AMH. AMH is the only fertility reserve testing that can be done on any day. Even Joe sonography, it gives me the best results only on day 2 or day 3.
Okay.
Because once
Okay.
the egg starts growing, I can't calculate the number of follicles very clearly. So day 2, day
अच्छा.
3 for FSH, LH, E2, ultrasound, everything. But AMH any day. AMH also, a lot of people ask me this question. So let me, there's no relation to food. You don't have to be fasting. There's no time of the day. There's no time of the month. You can do it anytime.
Simply visit the good lab and get yourself tested for this. But
Yes.
do your tests from reliable lab because it is really important. As Dr. Patel just mentioned that variation हो सकता है, but again one scan is the marker for you. So low AMH है तो please just a second. लो AMH है तो please don't worry about this. Just visit the right doctor. And if you are in Chennai, please do visit Dr. Patel at ART Fertility Clinics. ART Fertility Clinics have many centers all over India. Connect with us or you have the number on comment section. Call कीजिए, बात कीजिए, visit कीजिए. Just do the needful things. And yes, motherhood is the way. So thank you, Dr. Patel. Thank you so much for joining once again. So hoping for new session maybe in coming weeks or so.
Yes,
Thank you.
absolutely. Thank you so much. Thank you.
Thank you. Bye bye.